We recognize that the opioid situation is a very complex situation that is really facing our country right now, and we recognize it's a national public health crisis. At this point in time, we also recognize there's no silver bullet solution to all this. We all have to work together collaboratively, compassionately, in order to effectively deal with the situation on the ground. Our government has made it clear that we have no plans of decriminalizing drugs. However, we do want to work with individuals, and we want to have innovative solutions to come up with ways to effectively deal with this. Again, it's not just one solution. We have to work with all levels of government and all agencies in order to effectively deal with this.
But why just rule it out?
We've made it clear that at this point in time it's not an issue that we're looking at.
I understand that,
Yeah.
but why not?
Because we are exploring other avenues right now, and as you've seen with the announcements that we've made today, we've come up with some innovative solutions. We're working with frontline service providers and also people with lived experience. Again, there's not one solution to deal with this, and decriminalization alone would not deal with this situation.
Minister, a lot of these overdoses are happening from people who were prescribed the opioid. They're not just people at street level. How is the government tackling that specifically and tangibly?
Well, again, making sure that more services are available and training is available for prescribing medications with respect to doctors. We certainly have to look at that. I know that when we look at the profile of consumers, sometimes it's individuals that started with prescription medication, but we can see that the profile is different from case to case. So we have to certainly address that situation with respect to the prescription use. But also we, again, have to do a lot of work when it comes to providing the services that people need, and that is really our priority.
Should we be changing what we're prescribing?
Are you saying that the doctors are not properly trained to prescribe this?
Well, I'm not saying that. What I'm saying, however, is that we want to make sure that the proper information is given to ensure that everyone that is dealing with this situation can certainly get the help that they need, and that's really at the end of the day what our focus is and what our target is with today's investments.